Greetings to you from Sri Rama Hospital, Jaggaypet, Andhra Pradesh. Hello, I am Dr. Yogi Ram Bolisetty from Sri Rama Hospital, Jaggaypet. Now I demonstrate to you the method of making single hand knotting. So I will demonstrate the materials required and the technique of making the reef knots with the hand, then with the instruments, and later to make a knot in a difficult situation like in a cavity. Thank you. Hello, I am Dr. Yogi Ram Bolisetty from Sri Rama Hospital, Jaggaypet. Now I demonstrate to you the method of making single hand knotting. So I will demonstrate the materials required and the technique of making the reef knots with the hand, then with the instruments, and later to make a knot in a difficult situation like in a cavity. Thank you. Hello. Greetings to you from Sri Rama Hospital, Jaggaypet, Andhra Pradesh, India. This is Dr. Yogi Ram Bolisetty. Demonstrate to you the suture craft technique. The materials required to practice this are a drawing board like this. Take a foam, a block of foam, fix it to this drawing board with the help of these drawing pins. After secure it in place, then first you practice the method of making an incision. The instruments required for this are the scalpel or the blade. For making the skin incision, you can use a 22 number blade. So this is the BP handle to which the blade is attached. How to make the incision? First hold the scalpel in your right hand or in your dominant hand. Hold it between the thumb on one side, the index finger and middle finger on the other side, with the tip of the blade resting in the palm against the hypothenar eminence. Now keep your index finger over the blunt edge of the blades. Have a firm grip. Keep the blade at 45 degrees and then you make the incision, cutting through the tissues. Once you come to the end of your proposed incision, lift the handle of the blade to 90 degrees. By that, you are going to avoid the tailing of the incision. So this method of holding the knife is called dinner knife holding method. The other methods to do dissection with a knife are the pen holding method. When you want to do a fine dissection, you hold it in this manner, like you hold a pen. Now you can cut the tissues in this manner. The third method of holding the knife is in the stabbing method. You have a firm grip here, perpendicularly insert the knife into the tissues. This is method you employ while you incise an abscess to drain it. After you made the incision, now I will now demonstrate to you the method of suturing it. This is a polypropylene suture material to which a curved round bodied needle is attached. Now grip the needle in the needle holder. So this is the needle holder. These are the rings of the needle holder. These are the handles. These are the blades. And this is the fulcrum or the joint or the box of the needle holder. Here you have a ratchet. Now you hold the needle in between the blades, not at the tip, just within the tip, and hold the needle at the junction of the 1/3 from the swage end, 2/3 from the tip. So at this junction you have to hold the needle. Now the needle is ready for suturing. What you do is, either you can keep the handle fingers in the rings or the bows and then start suturing it, or you can grip the needle holder like this with the index finger resting over one of the handles to give a support. A curved needle must always be used by suturing it, passing it towards you. That means now I am going to change the needle direction. So this is the direction of the needle. A straight needle should be passed away from you. A curved needle must be passed towards you. So this is the wound you have made. Now I am going to suture this one. Hold one edge of the wound with the dissecting forceps. Keep the tip of the needle exactly at 90 degrees to the surface of the skin or surface of the wound. Pass it into the tissues, and while you are driving the needle, make sure that it is passed in the direction of the arc of the needle. The whole depth of the wound must be passed. Now the needle is allowed to emerge from the other end. While the needle tip is coming, you keep your dissecting forceps to apply counter pressure. Never use your fingers, lest you shall damage your fingers. So now take the grip from the needle, hold it little further away towards the swage end. Drive the needle. Now hold it. The needle tip is now held between the needle holder. Now gradually pull it through the tissues. Now how to get it out? Either you can hold between your fingers and turn it like this, or you can keep the needle aside and gradually get the suture through the tissues. Now you have to place a knot here. The dissecting forceps is in your left hand. Don't keep it aside. You palm it in your left hand. Use your index finger and middle finger to form the throw. Now I am forming the reef knot here. So I am doing the first finger throw or the index finger throw, then the middle finger throw, then the index finger throw, then the middle finger throw and index finger throw. So now I have formed the reef knot. Now hold it. Hold the end of the suture in a hemostat. Keep it aside. Take the needle holder and you resume the suturing again. Your assistant will hold the suture to allow it to tighten the suture as well as to approximate the wound margins. Now I am making a continuous suture.